Hello, how are you today? My name is Knchr from the Kenya National Commission on Human Rights. Now, let me ask you, when is the last time you checked on your child? When is the last time you checked on your parents? When is the last time you checked on your colleague at work or at school? When is the last time you checked on your uncle, your aunt, your niece, your nephew? When is the last time you checked on yourself? It is estimated that about 1 billion people across the globe are dealing with one mental health condition or another. In Kenya, mental health conditions such as depression, substance and drug disorder, bipolar, schizophrenia, and other psychosis account to about 13% of the mental health, of the disease burden in the country. In terms of costs, Kenya spends around or loses about 62 billion shillings annually on mental health conditions. And this includes absenteeism from work, disabilities that are caused by mental health conditions, etc., etc. According to the 2021 Kenya Mental Health Investment Case, it actually showed how if we invested on mental health, we could actually recoup much more over a 10-year period. Ladies and gentlemen, as we commemorate this year's World Mental Health Day 2023, which is themed Mental Health is a Universal Human Right, I would like to suggest that you and I take the following priorities. Destigmatize mental health conditions. Let us destigmatize mental health conditions in both law and practice. Let us amend our laws that contain derogatory terms that are abusive, derogatory, that are indignifying for persons with mental health conditions. Let us amend our penal code to decriminalize attempted suicide in order to provide space, open space for conversations on triggers for attempted suicide, and in order to enhance reporting and recording of data that then would allow for evidence-based interventions to be made. Let us not push persons with mental health conditions away from our spaces. In fact, what they need most from us is to include them and they be part of the community living, in our schools, in our communities, in our churches, mosques, places of worship, and in the various spaces that we live in. As the Kenya National Commission on Human Rights, we've also noted with concern the disturbing practice of shackling of persons with mental health conditions. We urge that such practices be stopped in order to ensure that persons with mental health conditions participate fully in the society and in our communities without discrimination. We need to work towards encouraging and investing in mental health. Over the years, mental health care has been neglected in our budgets. So I'd like to encourage both national and county governments to work at enhancing the budgets in order to promote mental health well-being up to the lowest, to the lowest levels in our communities. We recognize the great milestones made by the Ministry of Health in terms of formulation of various policies, such as the mental health policy, the mental health action plan, the suicide prevention policy, and now the national guidelines on workplace, on mental health at the workplace. Lastly, let us check on each other. Let us check on ourselves today. How are we doing? How are they doing? And together, let us promote and protect human rights of all persons with mental health conditions, and particularly for the most vulnerable in our communities. Thank you very much.